kata area waka malaria osenyo joma ng'eny kata nyithindo. An gi geno nikech Nyasaye momiyo dakteche kata dakteche rieko.
We can win this war. We can make malaria a problem of the past. And for this, we need science. In the 1940s, chloroquine was a very effective drug to treat malaria. Unfortunately, in the late 50s, we started to see this drug failing due to drug resistance, and the gains that were secured because of chloroquine were lost.
If you are sent into an area where malaria is found, don't take chances.
The Vietnam War was a bit of a pivotal moment. Malaria was killing more soldiers than bullets on both sides. So the need for new treatments was very much global. The discovery of artemisinin was really, truly a miracle. And we owe it to one single woman, Yu Tu, who actually earned the Nobel Prize for it and brought together her knowledge of traditional Chinese medicine and skills as pharmacologist and chemist. So the drug was registered in 1998 and changed literally billions of lives. My dad is from West Africa, Central Africa, so I grew up hearing stories about malaria. And so I completely appreciate the burden of malaria on the African continent.
Son, nakia malaria. To koringene na fwenyo seche moleo. Akunya nyithindo kamano ang'wen. Ang'eyo manyalo tere kodo ir daktari. To biro ni dende yore. Mamaga kodwa ni mul, kodwa no chiem to okodwar. Malaria, nan kode chon, tok nang'eyo.
At the turn of the century, treatments in current use were failing. There were a lot of malaria patients in the ward. It was getting desperate because people were being treated and they were not getting better. What has changed in that time period is that we've seen the introduction of artemisinin-based combination treatments, which have greatly improved the management of malaria and greatly contributed to saving lives.
We have really had a period of unprecedented investment in the fight against malaria, over $50 billion invested since 2000.
There is a vast array of tools that we use to fight malaria. The gains we've made have been tremendous.
Insecticide-treated bed nets, indoor residual spraying, rapid diagnostic tests to test those who are infected, and artemisinin combination therapies to treat them.
Community health workers are the first line in many health systems in malaria endemic parts and key to the fight against malaria.
It's estimated that nearly 12 million deaths and nearly 2 billion cases have been averted in this period. In the last few years, progress has slowed, and we're faced with a number of challenges that threaten the gains that we've made and the possibilities of making further progress.
So the time to act is now. It is urgent.
The job's not done, and there's still a lot of work for us to get to where we want to be, which is really to eliminate malaria.
If we don't do it and do it well, we might end up with a resurgence of disease like we saw in the 80s and the early 90s.
Magweng bed gi kwe maonge malaria. To chunya nyalo bedo mamor.